All right, so we get some microbiome. So which the organisms go. E. coli, staph, proteus. All right, cool. So you got a 45-year-old man with vesicurethral reflux, fever, chills, right side of flank pain. He's got leukocytosis, pyuria, bacteria, cortical scarring, and dilated calluses. So, I mean, it kind of relates back to what we were just talking about. He's going to have hydronephrosis, is the term I believe I'm looking for. Pyuria, bacteria. Yeah, so I think Proteus would be the one here. Because E. coli and Staph sapro can cause UTIs. Klebsiella, I don't think is a big UTI one. That's more you think of like nosocomial pneumonia infections.
Good.
And then Enterococcus fecalis is also going to be more, I'm trying to think of the acronym. It's heart, lungs, and joints, I think was the third. But again, I don't think it's going to be anything related to this. So then it's just breaking it down. Is it going to be like a standard UTI, or is it more going to be stone formation, which would be the Proteus moralis, so that does the staghorn colliculi. Um, yeah, I think I would go Proteus on this one.
Okay, final answer.
Mm-hmm.
Okay, so let's talk about this. So
Yeah.
you
Okay.
said Proteus, right, is mainly what? Stone formation, right?
Yeah.
Okay, so if you get an ultrasound, are you going to see a stone, yes or no?
Yes, you would.
You should be able to see a
Uh-huh.
stone, right?
Okay.
Right? So it says
Mhm.
cortical scarring and dilated calluses, right? Those are not stones, right? Those are just saying that he has a little bit of hydronephrosis, kind of what you're saying, right? But no stone. So if you're thinking it's a bacteria with stone, then you should be able to see a stone on imaging. Does it make
Gotcha.
sense? And
He'd
also
probably
on
be in more pain too, I guess.
Yep. And also on top of that, right? You have a 45-year-old male. The reason why it's not Staphylococcus saprophyticus is usually females, right?
Hmm.
Younger females, right? And so now, right, the most likely answer is the most common for UTIs is usually like E. coli, right?
Gotcha. Yeah, I guess I was just thinking UTIs in men are pretty unlikely, and the
Super
fact that
unlikely.
they gave you two UTI causing bacteria, I kind of guess thought there is like, oh, I guess it's one, they're unlikely, and two, they both could cause UTI, so it's probably going to be more the stone formation.
Gotcha.
Because
Yes.
for hydronephrosis, you're going to need some kind of blockage, right, to build up pressure within the calluses of the kidney.
Well, not necessarily, right? So think of it like this, right? So, always my bad drawings is what helps you guys remember. But you have your kidneys, your ureters, your bladder, right? And your
Hmm.
urethra here, right? So, I mean, in theory, right? Well, what can cause you can cause, if you have swelling, right? Let's say you have a really bad UTI and it contracts up one direction, right? And cause swelling, or you can cause, all this swelling or backing up, right? And not from an obstruction from a stone or anything like that. It can be anything. It can be a mass. It can be inflammation. Let's say like your ureters are super inflamed, then all of a sudden it gets blocked there, right? Just by
Hmm.
pure inflammation. So it's a lot of things that can cause hydronephrosis, right? So physical mechanical block, right, from a stone or a mass, right, or inflammation causing a block, right? But in the key thing here is that he's peeing out like pus, right? Pyuria and bacteriuria, right? So you know that all this stuff here is probably filled with inflammation and pus. So all this time, anytime that he pees out urine, there's pus in kind of the urine, which is never good. And your most likely cause is going to be E. coli here.
Okay.
And I think there's an age cutoff that I can't remember. Um, you have to look this up. I can't remember, but you can get like STDs that can cause UTIs, but I think is in a younger population. So something
Gotcha.
you can think about too.